My name is Stephanie Stratton. I am the Chief Nursing Officer at Frankfort Regional Medical Center. I had an extremely bad experience when I was delivering my second child. I was in a different career at the time. I was working in an accounting department for a manufacturing company. I made the decision. I had an 11-month-old and a 3-year-old, and I started taking nursing classes. It took me 4 years to get a 2-year degree because I had to do it slow and steady and work full time. And actually the last year of nursing school, I came to work here at the facility at Frankfort Regional. Loved it from day one. I worked full-time nights every single weekend and went to school full-time during the week and had a family at home. And so that's where I started my path. I've never had any dreams of going into leadership whatsoever. I just love taking care of patients. Within a year's time, I was a clinical coordinator, I was a clinical supervisor, an educator, then an interim director, and then was hired as the director of all of Women and Infant Services. I worked in labor and delivery as the director for 8 years. Total between bedside care and director, it was about 13 years. Decided that I wanted to kind of broaden my horizons a little bit, maybe be a CNO one day. So at that time, our division chief nurse executive met with me, and she told me, she said, well, you're too siloed. You've only done women and infant services. You really, in order to be a CNO of a hospital, you need to, have more opportunities, more experiences with other departments. At that time, our med-surg leader was leading her position. And so they asked me to take over our largest med-surg unit. And then after I had served in the role of med-surg director for about 18 months, our division leadership reached out to me to see if I would be interested in applying and interviewing for an assistant chief nursing officer at one of our sister facilities in Richmond, Virginia. I was an assistant chief nursing officer for 8 months. Then was asked to take over as interim chief nursing officer of that facility. I did that for 3 months, and then I was reached back out to come back to Frankfort to take over this hospital and lead the nursing. My favorite thing about coming to work here really is the people. There are lots of frustrations of being in leadership and being in healthcare administration. And that's why I say people in general, because it's not just about my employees, it's about the patients and every single patient that comes in that door. And it is my commitment to them that I drive these teams to be the best that they can be so that they can provide excellent care for every single patient, every action, every time.